All right, so let's get into cystinuria itself. Cystinuria, it's a rare genetic disease. I'm going to touch on this again, but unfortunately, guys, it's genetic. Thanks to mom and dad, you got this disease. It's chronic, and it's not going away. And no treatments that we have now are quote-unquote cures. It doesn't cure the disease. The disease is never going away. You're always going to have it. It's about managing the disease and being able to use techniques to prevent more stones from coming and effectively getting your disease into remission, which is what we really want to try to target. So, rare disease, you have 1 in 10,000 people in the United States have cystinuria. So how many patients? That's about 30 to 35,000 people in the United States have cystinuria. It's actually one of the more common rare diseases in the U.S. And then just as a fun fact, in the United Kingdom, it is the most common rare genetic disease. So it seems to be that maybe there's a bit of a founder effect there out of the UK population. But ultimately, you're saying, oh, my God, I didn't really – a lot of patients don't realize that there's that many other patients out there that have cystinuria, and yet somehow you may have never heard of another cystinouric or never met another cystinouric. And I think it's just that the information needs to keep going and keep getting out there, and hopefully we're going to attack that by what we're doing here tonight. And then I've already mentioned, you're going to get stones. People who have cystinuria, and we'll talk briefly about the genetics in a couple of minutes, and I'm going to talk about a lot of things. I'll keep saying I'm going to talk about them. Sorry about that. But regardless of the genetics in terms of what you might be, most patients who have certain types of genetics of cystinuria are going to form stones. Not everybody who has cystinuria will, but the vast majority will. And in most of them are going to have it by your younger years. 80% by the ages of 20, 25% will be about a little bit younger, and 30 to 40% in their teenage years. And ultimately, by the age of 40, 99% of patients who are going to form stones will have formed stones. Males and females are equally affected in terms of the genetic predisposition for having the disease, but it seems like men are somewhat more affected in terms of stone production, and we're not really sure. It could be lifestyle factors. All right, so let's do this genetic thing here. That's my best medical term, by the way, it's genetic thing. Hereditary, lifelong condition. We've already said that. You've gotten 2 bad genes for a protein, which we're going to talk about a little later, that doesn't work correctly in your kidney. But ultimately, what happened was that you got 1 bad copy from mom, 1 bad copy from dad, and then you ended up with 2 bad copies that give you a section of the kidney that's not doing what it's supposed to be doing, and you're left with forming lots of cystine crystals, lots of cystine getting into the urine, lots of crystals forming and crystals leading to stones. So the question earlier was, why doesn't anybody else in my immediate family have it? Well, this hopefully can give you a little bit of a schematic here. But if you look, right, mom and dad are both carriers of the gene. They have 1 good copy and 1 bad copy. So they may actually have been putting too much cystine in their urine but never formed a stone because they have a mixed types of genes in their DNA. And so what happens when you have a child, they're only getting half of the genetics from mom and half of dad. So in theory, you only have a 1 in 4 chance of having a child with cystinuria, as you can see here on the bottom, the affected child. It does happen, though, in families that 1 or 2 or 3 kids have it. And sometimes mom or dad may have had cystinuria. They may have actually had 2 bad copies, and they didn't realize it or never formed a stone, which is uncommon but does happen. And then they met up with whoever they're going to have children with or have a child with, and they have that person happened to have 1 bad gene, and then you have a much higher chance of kids having it. The point is that, mom and dad gave you 1 gene from each of them, and you got 2 bad copies. Thanks, mom and dad, and you're left with this disease. So hopefully that answers some of those genetic questions. We don't want to talk so much about what the genes are themselves or what goes on in the DNA. All you really need to know is that it's a bad gene, and when you have 2 bad copies of the genes, that section of your kidney doesn't work properly. And a question here about siblings and both being diagnosed. Is it extremely rare? No, actually, surprisingly, even though it looks like here that it would be 1 in 4, and then if you have another kid and they have it, it's another 1 in 4. which would be a 1 in 16 chance, so it's like 7% that both kids would have it. I've heard of lots of cases across the United States and Canada where that has been the situation. So I don't know why that is, but unfortunately it's not as rare as you might think.